Everyone. This is Dr. Janine Cross, and this presentation will be a very brief discussion of advocacy in healthcare. This PowerPoint was put together by my GA, Nia Gibbs Francis, and I thank Ms. Francis Gibbs Francis for putting this PowerPoint presentation together. What is advocacy? Advocacy, as you may have learned in your other courses, involves either an individual or group or their representatives pressing their case with influential others about situations which either affect them directly or, and more usually, try to prevent proposed changes which will leave them worse off. And so advocacy usually benefits an individual or group um, at a particular point in time. Advocacy is defined as a key concept in social work practice. It is defined as exerting influence on behalf of organizations and groups within legal power and political structure. Social workers in healthcare. Social work is an integral component of the U.S. healthcare system. Social workers are present in settings across the healthcare continuum. Social workers are providing services to individuals and family throughout the lifespan. They address the full range of biopsychosocial and oftentimes biopsychosocial spiritual issues that impact well-being. Social workers play a critical role in advocating for policies that reduce health disparities, improve access to healthcare, especially for vulnerable populations. You've Students in this course learned a lot about health disparities with their health disparity paper. And many of you discussed very comprehensively what what social work practice looks like on the practice, policy, and research areas in their health disparities paper. And so the goal is to help you understand the critical role that social workers play in advocating. So again, I strongly encourage you to think about um, your health disparity papers and the discussions that that you had around the social work role in addressing those health disparities. Also think about your health disparity topic, which for us was COVID-19, and how that impacted uh, vulnerable populations. And so again, you're starting to get a very good, solid understanding of the role of social work in improving and advocating, particularly as it relates to health disparities. And so, also through policies and practice, through technology and innovation, throughout this course, you're understanding the role of social work and how it plays a role in the U.S. healthcare system specifically as it improves access, quality, and cost of care. Another important thing to think about when you're thinking, when reflecting on the role of social work, is also understanding how policies are put in place to help um, patients improve their care outcomes. And again, your midterm paper, which discussed Medicare and Medicaid, and its role in improving outcomes in our healthcare system, again, particularly related to COVID-19. You understand how social workers can play even a pivotal role in helping to ensure um, um, healthcare services through healthcare payers as well. Medical social workers provide frontline services to patients and their families to help alleviate the social, financial, and psychological hardships related to adverse health conditions. There is a direct connection between health and mental health. We know that when people are suffering from health concerns, particularly chronic health conditions, it takes a toll on their mental health. Similarly and conversely, having a mental health situation or a mental health condition can lead to chronic illness as well, as we know a lot of stress and worry and acute stress over time tends to um, impact the body in ways that are devastating and even harmful. And we know that even with the ACEs study, the adverse childhood events study, which shows us that early life expectancies is reduced due to stress that occurred and multiple stress over a course of a lifetime, but course stress that occurred or harmful events or traumatic events that may have occurred in someone's childhood. Medical social workers also provide important services aimed at promoting healthy lifestyles, preventing disease, and addressing barriers to care and addressing access to care. And so, as frontline workers, oftentimes medical social workers are conducting biopsychosocial assessments, really understanding patients on all environmental realms, including spirituality. So we want to know how well they're doing or what their health status is. We want to know what their mental health or their behavioral status is. Um, and we also want to know how their support systems, families, how their relational systems are doing as well. And through understanding that, we can then put interventions in place and work interdisciplinary with our colleagues on medical teams or healthcare teams to help improve comprehensive care for clients. And as we've discussed earlier in the course, oftentimes social workers play a huge role in doing patient education related to chronic conditions and healthy lifestyles. Social workers play a key role in preventative care, preventing disease, or as we've learned earlier in the course, primary level of care. And again, we are also engaging in those uh, everyday activities, advocating, brokering, to help address barriers to care. That can be assistance with transportation. This could be mental health support that may reduce a client's ability to obtain their care, dealing with those social issues, those social determinants of health that may impact or influence access and quality of health care. And we're also advocating for improved access to Medicaid, Medicare sometimes, and Obamacare specifically. Patient advocacy. A medical social worker is first and foremost a patient advocate. It's the responsibility of the social worker to ensure that a patient's wishes are followed. We talked about that earlier in the course with advanced directives and living wills. And so we're advocating, but we're oftentimes advocating to make sure clients are getting the care, patients are getting the care that they need by quality, competent medical professionals. We're advocating to make sure that the financial burden is removed, that there's those social and mental health issues are being addressed. And in that way, we're also advocating to help clients navigate health systems and services and resources. Sometimes that's helping clients complete medical assistance applications, understanding rotation service of medical providers in the hospital, developing or setting up family meetings to improve communication between providers and patients. And so social workers are advocating on many levels in healthcare systems and making sure that the voice of the patient is heard and brought to the table as it comes to their care needs. Social workers can directly advocate on behalf of the patient by facilitating communication with healthcare providers or arranging health insurance coverage, but they may also advocate for patients' rights in general through policy making and leadership. Most patients, when they enter a health setting, is given or is made aware of their rights, and their patient bill of rights is one key document that was provided to you in the earlier weeks of this course. But we also use other type of documents and standards to help make sure that we are maximizing and advocating on behalf of of patients. And that is our social work healthcare standards and our social work code of ethics as well, which we briefly discussed earlier in the course as well. And those documents are available in the earlier weeks of this course. So, what are the ways in which a social worker or medical social workers can advocate? By keeping the entire team formed. This is the interdisciplinary healthcare team, making sure that we relay patients' wishes to the whole team and ensure cultural considerations are granted. Prevent unwelcome family intervention. Make sure that families are acting in accordance with the patient's wishes. Your advocacy helps protect your patients from uncomfortable situations. So our advocacy happens within healthcare systems with colleagues and providers and the systems themselves. But we're also in advocating for patients in their family systems and in their community systems too, to make sure that they have the support that they need and they're able to make decisions and be empowered to make decisions about their health care and their healthcare outcomes. Social workers provide assistance with social and financial issues. Don't let your patient be discharged with a fistful of prescriptions they can't afford. Sometimes we're providing assistance with medications. Oftentimes, social workers have the power to help. Um, Oftentimes, patients get their medications for free or reduced cost. We also are oftentimes involved in case management where we're actually um, part of that discharge process to make sure that clients' referrals and orders for home supplies are being met and additional home visiting support services or home health aid services or home visiting nurses are set up to support the patient's needs once they're discharged or if they're just in community settings needing assistance. Oftentimes, social workers are working in collaboration with community health workers, again, to make sure those social issues and financial issues are addressed. Um, Also, making sure that clients or patients are able to follow the care plan post discharge. And sometimes this is making sure that the child care is set up, transportation is set up, and or education related to the discharge needs and assessing the client's ability or the patient's ability to meet the follow-up care and the medication requirements. Be the example of excellence through compassionate care, treating patients with dignity and respect, and modeling that to your colleagues. You're reaffirming their individual as well as their patient rights. Make sure your patients understand what is happening within the healthcare system, that education and that navigation role that also is involved. Patient navigators to help them navigate through the healthcare system, understanding what the intake, what admissions look like in the hospital, what care planning looks like in the hospital, how doctors and nurses are assigned, um, maybe educating them about rounds, making sure patients are involved in the rounds specifically. Explain that they have the right to refuse tests and procedures until they fully understand them, and making sure that the medical team uh, do their part in making sure that patient is educated properly and understands the care that they need. Teach them to advocate for themselves. So another way social workers advocate is to empower clients to advocate for themselves. And through awareness and education of healthcare systems, we equip patients with those skills to advocate for themselves by setting up family meetings where we give clients or patients the opportunity to voice their concerns or issues related to their care or the care plan is how we help and support patients in advocating for themselves. Client advocacy, ways to teach clients how to advocate for themselves, acquire personal health knowledge, legitimate medical resources, making sure we provide them with that. Provide patients with a wealth of knowledge concerning diagnosis, medications, and procedures. So increasing their knowledge base and providing them with information, pamphlets, websites, um, um, legitimate, reputable websites to acquire personal health knowledge, um, directing them to websites that help them screen themselves for concerns, utilizing resources such as their health insurance coverage and plans to discuss their health concerns or obtain more information about particular diagnoses. Use trusted sources to help choose a new doctor. Patients should rely on trusted health professionals when choosing a physician. Pharmacists often know reliable local healthcare providers. Suggest scheduling a face-to-face interview or consult and stress the importance of feeling comfortable with their choice. Oftentimes, particularly with communities of color, helping them find providers that are culturally The shared cultural background, ethnic background, racial background might be helpful and supportive for clients, especially clients who have chronic health conditions or clients that patients that have that suffer from poor outcomes related to health disparities. Request good communication. Emphasize repeatedly to your patient that they have the right to understand their healthcare. Tell them to ask for an interpreter if there are language barriers. The above discussion mentions just a few examples of patient advocacy, though. There are many things that's discussed in this presentation that medical social workers can do. As a nurse or a social worker, you have the best opportunity to secure rights, equal treatment, and freedom from suffering for your patients. And all members of the healthcare teams can serve as advocates, and should serve as advocates, even though oftentimes social workers are leading the health team when it comes to areas of advocacy and support for patients. But we are oftentimes partnering with our interdisciplinary colleagues, such as nurses and physicians, to help secure rights for patients. Micro-level advocacy includes ensuring translators are available for clients, making sure patients receive medical information in their primary language, simplifying medical terms to patients, making sure they are prescribed medicines they can afford, or putting services and supports in place to help them afford their medicine, educating patients, advocating for equality within um, healthcare, despite a patient's insurance, racial, ethnic, socioeconomic status, or background. Meso-level health advocacy includes encouraging cultural competence within medical settings, encouraging that translating services are implemented routinely within hospital settings, analyze policies, ensure that they are beneficial and equal for all patients, making sure policies also impact health disparities specifically, maybe use of technology to improve health outcomes, and analyzing how technology in the hospital is improving that health outcomes. Reform discriminatory policies or policies that disadvantage vulnerable populations may also be meso level healthcare advocacy. Also, your public service announcements may serve on either a meso or macro level, depending how it's disseminated, and the groups that are targeted for it. And so think about that as well when we're thinking about healthcare advocacy on the community level. Advocacy and healthcare policy on the macro level, social workers should be involved in advocating on behalf of clients in healthcare at the macro level as well. This can be through lobbying for certain healthcare policies, voting for candidates that support healthcare reforms that assist vulnerable population, or informing communities about healthcare policies that are up for debate. It's important to know here that our ethical duties, you'll find that in our NASW Code of Ethics, advocacy is an ethical standard embedded in our social work values. And so this is, again, just a brief overview of um, what healthcare advocacy looks like, and the role of social work and advocacy. It may vary from health setting to health setting, but these are just general principles of advocacy for healthcare, a social work. Please be sure to read your textbook chapter on advocacy in healthcare practice. As this is just a brief overview, students are expected to make sure that they complete the readings in detail. Thank you.